A year and a half ago, we were in the middle of a general election campaign, and there was one message I heard loud and clear on the doorstep. We want things to be different. People said they wanted a government that didn't just do what was good for their headline or good for their party, but good for the long term and for our country. That's what we're engaged in today. Clearly, cutting public spending isn't popular, but it's right to bring sense to our public finances. People said they wanted a government that gave more trust to them. That's the kind of government we want to be, giving neighbourhoods, communities and individuals a whole range of new powers, scrapping much of the bureaucracy that drove us mad. Now, the National Health Service is a hugely emotive subject, and it's a debate too often shaped in the past by assertions rather than substantive arguments. We've all heard them, the assertion that NHS is an unalloyed good and that controlling it is an economic madness, the view that Britain is a soft touch and that the NHS is out to take whatever it can get. I believe the role of politicians is to cut through the extremes of this debate and approach the subject sensibly and reasonably. The last government, in contrast, actually helped to inflame the debate. There were Labour ministers who closed down discussion, giving the impression that concerns about the NHS were somehow not a problem. This is where our government is so different. Rather than just delaying the problem and allowing it to get worse and worse, we want to tackle the problem head on before the problem snowballs beyond all control. But I'm also clear about something else. For too long, the NHS has been too expensive. Between 1997 and 2009, the time when Labour were leading this country, NHS spending has more than doubled in real terms, from £38 billion to £103 billion. Can we really say that the improvement in service has reflected that increase? Can we really say we're getting value for every pound that we spend? We're also getting too much difference in the quality of services people receive, a great gap between the best and the rest. We're seeing a deep divide between health and social care that is causing serious problems for vulnerable, often elderly people and their families. Clearly, the country is finding it difficult to look after its own. We have had the largest influx of people immigrating to Britain over the same years that the NHS has nearly trebled in cost, and it has placed real pressures on communities up and down the country. Not just pressures on the NHS, but also schools and housing, as well as social pressures too, because real communities aren't just collections of public service users living in the same space. Real communities are bound by common experiences, forged by friendship and conversation, knitted together by all the rituals of the neighbourhood, from the school run to the chat down the local pub. These bonds take time, therefore real integration takes a long time. So, taking this into account, I believe controlling immigration and bringing it down is of vital importance for the future of our country and the NHS. That's why, during the election campaign, Conservatives made a clear commitment to the British people that we would aim to reduce net migration to the levels we saw in the 1980s and the 1990s. In doing this, we have been, by integrating the NHS within communities, what we are able to do is give you, the people, the power and make the NHS for you, about you, the British public. Yes, in many ways the NHS is providing some of the best service it ever has. But we have to be honest, we're wasting too much money on empty bureaucracy. We want it to be up to you, the community, to decide how the money is spent. I repeat, we are not trying to cut the NHS. In fact, we are spending on the frontline service of it. And it's why some of the money we save in eliminating waste and bureaucracy is going back into the frontline service. But there's a more important point I want to make about money and your NHS. Every year, without modernisation, the costs escalate. Demand pressures increase, driven by an ageing population, reckless drinking, and younger people abusing drugs. The last government became too target obsessed. It was all about getting addicts in touch with treatment agencies, and this, in too many cases, meant they were on a slow drug rehabilitation course, sometimes taking years to overcome. This is too expensive to carry on maintaining, and not good value for money. We would like to try to provide, difficult though it will be, given the shortage of money we have been left, and that is why we are having to approach it in this way, through more residential treatment programs, meaning we will not have to waste money on nurses, care, expensive treatments and hospital beds, which can remain for people who actually need them. In the end, the way you get addicts clean is if they want to challenge their addiction themselves, rather than forcing them off them, going cold turkey and giving them support and advice. I will reiterate, cutting the NHS is required. We are cutting spending on the inner working of the NHS, but we are pumping some money back into the front line. But we can't pretend that the extra money we are putting in will be enough to meet the challenges we have set for the NHS. So we need to reduce the demand for healthcare, which is why we are prioritising public health. One of the ways I plan to do this is through competition. I've heard the desire for more choice on behalf of some patients I was talking to at the Royal Hospital of Chelsea. But they want to be sure that competition is introduced in a properly managed and orderly way. Now, I do believe competition is a good thing, but not as an end in itself. It is a means of bringing in fresh thinking, new ideas and different ways of doing things that deliver value for money. But there's another argument to be made for real patient power, along with cheaper, more viable treatments rather than surgery. I remember being told by one of my writers who was talking to an Asian woman who injured her neck, but couldn't afford to take the time off work that came with going through an operation and the long period of recuperation that would entail, and so was given a choice. So she opted for physio instead of surgery. And not only was that cheaper for the NHS and to the taxpayer too, but today she's leading an okay quality of life. So we want to spread more of these choices and chances. We're saying that for the first time in the history of the NHS, if you are offered surgery, you will be able to decide whether you want to go for a cheaper option, like physiotherapy, that will allow you to lead independent lives as long as that service meets NHS standards, NHS practice and NHS costs. Indeed, 1 in every £20 currently spent by the NHS goes to a private provider, and this will increase under our new plan. Providers like the independently privately run and owned Horder Centre in East Sussex, which delivers orthopaedic care and has high patient satisfaction, low rates of readmission and excellent outcomes. So, private companies provide good service for good value for money. For new providers, more choices, competition raises standards and delivers real values for money. The way we are introducing competition is through seeing which companies, businesses or indeed the National Health Service can do the job for the best price, and the health service in that area will go to that company. Treatments will remain free, but there will be more options for private care. Of course, there are those who would argue that competition encourages cutting corners, since it will make profits even higher. But rest assured, we will do our best to stop this. But people want to know what this does and does not mean. So let me be clear. Yes, there will be an NHS, private providers and private sectors. But let me also be clear. We will not introduce an American-style insurance system. Now, as our legislation currently stands, Monitor, the health regulator, has a duty to promote competition. The system that we live in today states that no one company, business or firm can have a monopoly. We have seen what can happen if one does with Rupert Murdoch's media empire. And at the moment, the national health system has this monopoly. Competition is clearly required to stop this. This could be misinterpreted, and we don't want any doubt in anyone's mind. Monitor's main duty is to protect and promote the interests of people who use healthcare services, and it will use competition as a means to that end. Not simply to promote it or prevent it, but to secure the services patients need. That's why we will look to make sure private companies are only paid for the services they provide, and that they contribute to the costs of training NHS staff. Private companies will be looking to make a profit, and realistically, we will have to allow them to cut corners and make a profit. Otherwise, they would not be looking for this contract. We cannot control them cutting corners or customer satisfaction of care. This is absolutely central to the vision for the NHS. Thank you very much.